Hi everyone, and welcome back to the Cyrus Yuan channel. Today, we will be talking about psychology, specifically phobias. Today, we will be talking about what are phobias? What is the cause of phobias? What are different types of phobias? What are the usual symptoms of phobias? And what is the treatment for phobia? A phobia is an overwhelming and debilitating fear of an object, place, situation, feeling, or animal, and more. They can be actual objects or animals you are afraid of. For example, spiders, injections, bats, blood, or they can be situations like when you're afraid of the height or when you're afraid of the dark. The reason of having a phobia varies with a lot of numbers of factors. For example, it could be a particular incident or trauma that usually happened when you were younger. So for example, you were trapped inside an elevator and you would get claustrophobia. Sometimes phobias are passed down from parents or siblings through genetics. There are a lot of types of phobias, separated into two groups. Number one, specific or simple phobias. Specific or simple phobias are some easy to treat phobias. For example, animal phobias, snakes phobias called ophidiophobia, spider phobias called arachnophobia, or environmental phobias, for example, when you're scared of heights, acrophobia, or when you're scared of weather, astrophobia, or when you're scared of dark. Other types of simple phobias include situational simple phobias, which involve when you're afraid of enclosed spaces like claustrophobia, when you're scared of driving, amaxophobia. Okay, and then there's the last type of simple phobias are bodily simple phobias. So it's usually when you're scared of a medical condition, like when you're scared of blood, hemophobia, or when you're scared of injections, trypanophobia. The second main type of phobia is called the complex phobia. They are usually more disabling and harder to treat, and they usually have deep roots of anxiety in a particular situation. There are two main complex phobias. The first type, called agoraphobia. This phobia is commonly misunderstood as a phobia of open spaces, but it's actually a phobia of a place where you can't escape from. The second type is social phobia, which is just a long-term fear of social situations. Some common symptoms of phobias, and there are usually some anxiety disorders, include unsteadiness, dizziness, lightheadedness, nausea, sweating, increased heart rate, shortness of breath, trembling, shaking, or upset stomachs. In different cases, there are different types of these symptoms. So people scared of different things will have different symptoms towards their phobias. Okay, now let's talk about the treatment of phobias. Phobias are mostly treatable, thankfully. Well, at least simple phobias are mostly treatable, and you don't really have to seek professional help for this one. You can just use gradual exposure methods for a self-help program. So you gradually expose yourself towards what you're scared of. So if you're scared of oranges, first day you look at the oranges, second day you smell the oranges, and the third day you eat the oranges. But it's different from complex phobias, where you usually need some professional help. For example, counseling, psychotherapy. These two types are similar. Counseling is usually more short-term, and psychotherapy is usually more long-term. These are when you see a therapist and they try to discuss your phobia and try to make you view your phobia in a better way, which also works similarly to cognitive behavioral therapy, commonly known as CBT. Another type would be exposure therapy, which is when you expose yourself to what you're afraid of. Unlike gradual exposure that you can do on your own, this time a therapist helps you do it. A therapist sets a timetable for you. The last type would be antidepressants, which are medicine or drugs that you have to take if you have a very, very serious condition of this phobia. Thanks for watching. Remember to like, subscribe, and watch my other videos.